Well, hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I am your host, Shawn Needham, and I am streaming live from downtown Coeur d'Alene, Idaho. And as you guys know, I love Idaho. It's great to be in Idaho because guess what? There are no mask mandates, or at least they're not being enforced. Restaurants are open up at full capacity. I tell you what, right when I crossed the border yesterday, the virus. You know what virus I'm talking about. I don't even like saying the word. It just stops at the border. It's amazing. So I am free in Idaho and I am loving it. A little chilly this morning, but still beautiful, great time to be in Idaho. And I'm going to enjoy my day here. So today we will be talking about corrupt hospital billing practices. Now, actually, it's like kind of an obvious word now, because it seems like all hospital billing practices are corrupt. And I will tell you, the more I expose this, the more I find out people come out of the woodwork and it's like, yeah, this happened to me, that happened to me. And I'm going to share my personal experience of what happened in corrupt hospital billing practices. And it really all starts with insurance companies and hospitals being in collusion together. It is absolutely like a drug cartel. It really, honestly is like a cartel. I'm serious. And they are in collusion together to guess what? To screw you. Yeah, that's you, the consumer. And yeah, you might have what you think is great insurance, and I've got good insurance and it pays for it. Oh yeah. Well, I have said before, I don't think there's such thing as good healthcare insurance anymore, because it's all too expensive and it doesn't pay for anything. And your copays are high, deductibles are high, and there is another option outside of traditional insurance, and that is called a health sharing program or account or ministry. They used to be faith-based, but now there's a few of them out there that are not. New Health, KNEW, is one of those. And it's where you get to choose a doctor, you get to choose the hospital, and guess what? You get to negotiate prices. How beautiful is that? Like when you buy a car or you buy a house, you negotiate a price. That's what you can do when you pay cash for services and somebody else reimburses you. I will talk a little bit more about that with my personal experience and my son's broken leg. But in general, hospitals up the price tenfold of what the charges really should be. Let me give you an example. My son, he broke his leg in May of last year. May of last year. It'll be almost a year here in a few months. And I got to say, he got great care. I have no complaints there. He did get great care, from the ambulance ride to discharge at the hospital. He got great care. But one of the things that is not good about hospitals or an ambulance ride or any of that is that they're not transparent in pricing. And they like to hide behind prices. They don't like to be transparent. Now, last year, President Donald Trump signed into an executive order to have hospitals be transparent in pricing, and they've got to start posting their prices online. Now, as great as that may sound, it's just not quite that easy, because in most hospitals, you ask them the price of a knee surgery, a total knee surgery, ask them total left knee surgery. They're not going to know, but they're going to say this, because I've had this personal experience. Oh, all of our prices are online. It's called the Charge Master. So they'll give you this funky little sheet, that has all these numbers on it, from every little thing to billing for a Tylenol, to billing for a toilet seat, to billing for a bandage, to billing for a bed in the ICU, to radiology services. Everything is on there. But guess what? When you have a total knee surgery, everybody's charges are different. So they're not the same. Now, they don't have to be. That's not completely true all the time. So, and I'll give you an example of that a little bit later, when I'm making comparisons of how hospital charges compare to somebody that has transparent pricing. So my son gets discharged from the hospital, and we have no idea what the bill is going to be. You know, my guess is as good as anybody's. So anyway, we end up getting the bill, and it was about $48,000. Now, so I refer a lot of people to the Surgery Center of Oklahoma, and Surgery Center of Oklahoma, if you look them up, they were the first surgery center, the first kind of cash business model of any kind of healthcare. And Dr. Keith Smith, who I've interviewed before, and I've toured the surgery center and met him. He, in 1997, opened the surgery center with the thought of being transparent pricing. So a total knee surgery is XYZ, or, you know, whatever that procedure is, all inclusive. So what does that mean? So when my son got discharged out of the hospital, the bills were very confusing. There were bills from multiple places, you know, radiology, the physician, laboratory, radiology reading, and then the hospital, and I might be missing some. And, you know, I consider myself pretty knowledgeable about healthcare. I mean, I'm in the industry for one. You know, I'm a pharmacist. I'm in the industry. I've been a commissioner, a public hospital commissioner, and I know the inside workings, and it confused me. So after getting some clarification on pricing and looking up what the Surgery Center of Oklahoma charged, he had a broken left tibia. It was a compound fracture, okay? And the bill was $48,000. That was all in, that was everything, the radiology, everything. And guess what the price was at Surgery Center of Oklahoma? $8,000 out the door. That's anesthesia, that's physician fee, that's hospital stay. It's not overnight or anything, but that's everything, all inclusive. $8,000. So, you know, you're talking about a six-fold difference in pricing. That is pretty common. One thing that I normally see about is patients will usually pay about tenfold what they would pay at a hospital that bills insurance over a transparent pricing one like Surgery Center of Oklahoma. So let me give you some other examples. So, you know, let's just say you could argue this. You're like, oh yeah, but my insurance covered it, so I got a great deal. Okay, think about this. And we see this all the time. So, you know, patient goes in, they want to do a surgery like that. You know, they want to use their insurance because they've got good insurance. So they end up going doing the surgery, and guess what? Your copay is 20% of the surgery. So guess what? You end up paying like $9,000, right? 20% of $48,000 is over $9,000, right? Almost 10. Or you could pay cash and go to the Surgery Center of Oklahoma. And one of the things is that you get better service because you're the consumer. They're taking care of you. You know, when you go through the insurance racket, the insurance company is the customer, not the patient. Think about that, because they're the one paying the bill. So that's why when you pay cash up front, you not only save money, even if you have insurance, think about that, but you'll get better service and you get better quality. Why? Because the doctors that do surgery at those places, they know they have to do a good job or they won't be invited back. Whereas hospitals all the time, oh, I opened the wrong bag for surgery. That's an extra $2,000 charge, but we'll just bill the insurance company for it. Happens all the time. Yes, it does. I know somebody that runs a surgery center, and she says it happens all the time. So when somebody's paying cash for it, you can't do that. You can't just overcharge them like that. So it doesn't work out that way. That's why it's better for the consumer overall. Now, not very often in any industry, we say you can have two of the three. You can have it fast, you can have it inexpensive, and you can have good quality. I will tell you this, in healthcare, when you search out cash services, you get all three. Usually in other businesses, you can get two of the three. So you can have it fast, you can have good quality, but the service is going to be, but the price is going to be high. You know, or just two of the three. So Where in healthcare, when you're paying cash, you get it all. So I get these bills from my son, okay? And I negotiated at the hospital, went round and round for months. First of all, here's what the question I asked. Here's one of the first questions I asked. I want detailed billing. I want a detailed bill of his charges. It was like pulling teeth to get that. I wanted CPT codes also. So CPT codes are the codes that are how they bill insurance. And it took forever to get those. I mean, it took months to get those. And I had to go through multiple layers to find out, to find those. Now, why did they not want me to have those? Because it's really actually, once you have those codes and you have an EOB with those codes and you have, or a billing statement with those codes, you can go to a website, and a Medicare website, and you can find out what their allowables are. So you can tell what the hospital was going to get paid by Medicare, okay? Because remember, the hospital bills $48,000, but nobody pays that. The insurance companies don't pay that. They have a contracted rate that they negotiate down, and they pay much less, usually well under 50%. So you tell me why it's fair that a cash paying consumer that's going to pay, right away, why is it fair that they get charged, 6 to 8 times over market, and the insurance company pays a lot less, yet the insurance company pays a lot slower. You have to dot their I's and cross their T's, or they reject it. The insurance company takes money back months later, sometimes years later. So as a cash paying consumer, who gets screwed? I'll tell you who gets screwed is the uninsured. And hospitals brag about, want to take care of the uninsured. Well, let me tell you something. And they brag about their charity care and all that. Their charity care, it's really not charity care. When they overbill all this stuff, then they write it off. They write that off as charity. And, it's really kind of a racket. It really is. And they've got so many different income streams that I am not worried about hospitals, about them making a profit, because they always find a way, and they hire a lot more people. So they always find a way to make a profit. So during this process, I contacted one of the administrators, and he admitted that, yes, this is a national problem. This is not, just something that's localized. This is a national problem. He admitted it. But guess what? He wasn't willing to fix it locally. And I think the only way to fix it locally is to educate and empower consumers that they are in charge of their own health. That's the only way to do that. And that's one of the goals of this podcast, is to educate and empower consumers that they're in charge of their own health. Not only be proactive in your health, but also fiduciary responsibility. So be financially active in it. So know what, if you do have insurance, shop for the best price, shop around, shop for the best service. It's like any other commodity. If you were listening to the podcast last week, Ethne Nance was on our podcast. It talks about in-network physicians and in-network facilities. And guess what? They're not always the best. That's for sure. They're just the best for the insurance company, not for you. The insurance company is not looking out for you. They're looking out for their own pocketbook. So make sure you do your own research on those facilities, and possibly it could be better off to pay cash. So he knew there was a problem. He didn't want to fix it. So I finally negotiated. So when I went over it, one of my negotiation tactics was, hey, this is what you're going to get reimbursed from Medicare. If all went well, they would have got reimbursed about $15,000. So I said, I'll cut you a check for $15,000. Now, I have a health sharing ministry. Jan and I have Christian healthcare, and we pay the bill, and then they pay us back. So that's the way it works, okay? And it works out great. It works out awesome. So I negotiate the price with them, and they weren't willing to come down at all. And then they finally did come down 20%, and I totally respect that. But here's the caveat. In our communist state of Washington, Yeah, I just said it. As you can imagine, we had a law passed, and there were a lot of people with health sharing programs like myself that were going to hospitals and negotiating discounted rates. And we had a doctor on our podcast before, Kirby Farnsworth, and he's out of Arizona. And Arizona doesn't have a crazy law like we do in Washington. So he had a patient that had a heart attack, and the bills were like $350,000. I think I can't remember the exact total. Anyway, the hospital wrote off like $300,000. Now, let's just not feel sorry for the hospital. Don't feel sorry for the hospital that they lost $300,000. What they really did is they charged what it should have been in the first place. So they wrote that complete bill off. The patient only was responsible for $50,000, and the patient got reimbursed through Christian healthcare the $50,000. So it was great because it saved the healthcare system money. Now, the hospital didn't make as much of a profit, but I think maybe you're coming on to where this scam is going on, that they're just overbilling. They know that it's not appropriate, the amount they bill. They all know it. It's a game, and they keep playing it. So they did accept 20% discount. And yeah, okay, let me get back to the law in Washington State. If you have a health sharing ministry in Washington State, the hospital cannot discount you. Yeah, in Washington State. So you know how they wrote off $300,000 in Arizona? I was telling you about the story. Yeah, I can't do that in Washington. And why'd they do that? Well, because the hospital has a big lobby, and so the hospital association lobbied the legislators and said, "Hey, we need to make this law." And so that's exactly what they did. And I think that we should get rid of that bill. So there is some kind of discount they can give you, but it's only up to a maximum amount. So that was kind of where I was stuck. Now, one thing I did do is that I talked to them before. I was in contact with my health sharing ministry regularly, and they were ready to pay. It was great. I highly recommend Christian Healthcare. They were ready to pay within like a week, faster than any insurance company would have. They wanted to write a check just right away. And I'm like, you know what? I want to do my fiduciary responsibility and make sure I can get the biggest discount possible. So I did do that. And it took me months. And it's just because of the bureaucracy of most hospitals, or I should almost say all hospitals. I know it's a strong word, but it's just kind of true. It took that long. So now, after I did get the negotiated price down, I negotiated a price for 20% discount. So it saved me $9,000, and I'm gracious for that. I appreciate that a lot. And what I negotiated was payment over 12 months. I was going to pay him monthly over 12 months. That was what I negotiated. Okay. Just keep this in the back of your mind. They were happy with that. I was happy with that. I think I should have got a bigger discount, but it's all I could get. So I would appreciate at least something. So Christian Ministries or Christian Healthcare writes me a check within about a week. And let's think back about that. Remember that it's none of the hospital's business how I pay for my healthcare bill. It should not matter at all. So first of all, the bill, the healthcare bill, the Senate bill that talks about hospitals not being able to discount people with health sharing ministries, that's shouldn't even matter. It's irrelevant. When you go in and buy a car, and if you tell somebody, I've got payment, I'm going to pay you, do they ask where you got the money? No. So why should healthcare be any different? What's the first thing that happens when you walk in a hospital? Oh, what's your insurance? That's all they care about. They want to know how much they can bulk your insurance company and how many add-on things they can do to bill, all that kind of stuff. That's the first thing they want to know. That wouldn't happen if the consumer was paying up front and paying cash. So fast forward to about 3 weeks ago. My son gives me a bill that he was getting in the mail. and it's a new $1,132 bill. And it was from a date of service in December that he wasn't there. It was from a doctor he didn't know, never saw, and it was for a service he never accessed, laboratory services. And I knew from the history of working with this hospital that calling on the phone would be very painful and pretty much worthless. So I went ahead and I went to their billing office, which is not far from where I work. It took them 3 different people 45 minutes to sort out this bill. Not kidding. So in the end, what happened? Well, let me just tell you what happened. The doctor's fee was about $5,800. If you do a 20% discount on that, it's like $1,132. I'm not doing the exact math, but something like that, okay? They took the discount they were going to give me on my son's bill, and they actually applied it to an invoice and sent him another bill. I'm not kidding. And it took them forever to figure that out. A doctor he didn't see, a date of service where he didn't access it, and for a procedure that never happened. And their claim is that they went over to a new billing system in December, and that's how they had to do it. Now, obviously they didn't. Hopefully, they didn't mean to put the discount as a bill, but when you think about that, wrong date of service, wrong doctor, laboratory service. So how many bills out there floating around like that? If anybody has any bills like this that have happened in the hospital, give us a call, 509-537-0411. We could discuss them on here. I would really love to hear your story, because one thing I noticed when I was posting about these things is this is not an isolated incident. So I asked them, well, what happened if we would have paid this? Because it was already the second bill they sent us. Next one is going to go to collection. I don't want my son to go to collection because it was under his name. So they did take care of it. But what I want to warn consumers in healthcare is look at your billing statements from your insurance. It doesn't matter if insurance paid for it or not, because many, many times they are inaccurate. And that's what I want to expose, is that you need to do the due diligence and make sure that everything that is on that bill is for you. No different than when you go to a hotel. Imagine if you went to a hotel and you got a bill for a room you didn't stay in, for a date that wasn't there, and you bought something on that there's something on that bill that you didn't buy. That's kind of what this bill is like. And there's a lot of hospital bills like this. So that's what I really want to educate and empower consumers about, is that look at their EOBs, make sure that they are that you receive the services that are billed on there. Now, in a few months, I think in April, we have Ethne Nance back on, and we are going to directly go over an EOB and what you should expect from an EOB, and what you should expect from allowables too, is how much should each procedure be reasonably reimbursed at. So don't miss out on that episode. So now, one thing I really wanted to talk about is this all segues into my book. My book is Sickened: How the Government Ruined Healthcare and How to Fix It. And it is available on Kindle audio form and is also available on paperback now. And there's a 6-step solution, because remember, this is Health Solutions with Shawn and Janet Needham. We talk about solutions. We don't just talk about problems, okay? We talk about solutions. There's a 6-step solution in there. And every one of the steps besides one is you're in charge. The first one is be proactive in your health. And in chapter 6, I talk about the 6-step solution. And chapter 6 it starts out with this, a quote from me: the best health insurance that we have is not some policy that we can buy. It is how we take care of ourselves. That's the best health insurance we have, bottom line. I'm going to go ahead and go over all the 6 steps. I'm going to just give the book away because these are important facts. So number 2, Shop around for healthcare. Look for cash prices, even if you have insurance. Okay. Number 3, this is where employers come. This is where employers come in, but you still are in charge. Employers should offer an, instead of health insurance, they should offer HSA accounts. So they give you the money to spend on the healthcare that you want to buy. Now, how great is that? Wouldn't you rather have the extra money instead of your employer having it? Or wouldn't you rather decide what doctor you go to, what hospital you go to, what healthcare services you access, instead of your employer deciding for you? I wouldn't want my employer deciding for me where I go to the doctor, for sure. So that's the 3rd step. And the 4th step is pay cash for services. You'd be surprised. Yes, it's cheaper than many times your insurance is. Let me give you a good example. I know somebody. She had an ultrasound, and her ultrasound was like $800 or $900 through insurance, something like that. She ended up having to pay like $300 out of pocket, or she could have upfront paid $200 cash. So what would you rather do? MRIs all the time. MRIs, $3,000 through insurance. You know, the insurance copay, $800. Or you could pay cash for one for $500. And guess what? No prior authorization, no dilly-dallying around trying to get stuff authorized. You just get to go in and get your procedure done. How cool is that? So that's number 4. Number 5. This is number 5. This is where healthcare providers come in. Healthcare providers need to stop being accessories to the crime. I used to not say this because I used to protect my colleagues. But I had Dr. Keith Smith actually quote this, and he's the one, he quoted it on my book, on the cover of my book. He said that when he was in a hospital system and he saw the racket going on about how things were being overbilled, he felt like an accessory to the crime. And I got to agree, whether you're a doctor or whether you're nothing personal, whether you're a doctor, whether you're a nurse, whether you're a pharmacist, if you are in the insurance racket, you are essentially an accessory to the crime. I know there's some haters out there. They're going to say how mean that is, but I think it's true. And actually, I've got a lot of good friends because of this podcast. I've met a lot of good doctors, great doctors all over the nation, and they actually had to get out of medicine. It was either get out of medicine or go into cash services like direct primary care, which we've talked a lot about in this podcast, which is very affordable. Direct primary care, it's a monthly membership. You can pay like $50 a month to see a doctor unlimited. It's amazing. So they feel like it's so immoral to be in the racket that they have to either get out of medicine or go into cash services. Lots of doctors like that. It's really too bad it's happening, but that's really what is happening. So number 6, I talk about there is no such thing as good health insurance. So what do you do as an option? Health sharing ministry. There's a lot of health sharing ministries out there: Christian Healthcare, Samaritan Ministries, Liberty Share, MediShare, Zion Health. New Health is a non-faith based one. I think Sedera is out there. I don't know if Sedera is okay in some states. So you got a lot of options now. And the good thing about those is with most of them, you pay upfront. Okay, now you think that's bad, right? But remember, most of these places will negotiate some kind of payment strategy with you first. So if it's a big bill, catastrophic bill, they'll negotiate some kind of payment strategy. Because remember, they don't get paid by the insurance company right away either. So, and I can tell you with a health sharing ministry, they're going to normally get paid faster than they would with an insurance company. So what happens with these health sharing ministries, most of them, not all of them, I like the ones where the consumer is responsible for the bill. So if the consumer is responsible for the bill, you're going to make sure you get good. You're going to make sure you get a good price, even if you are being reimbursed for it. So, and that's another thing I wanted to mention. So while I was talking to the hospital about the bill that was misbilled, $1,132, they looked at me and they said, I said, well, I'm holding up to my end of the bargain. I'm paying what I said every month. And we negotiated over 12 months. And they said, well, didn't you get paid for this already? I'm like, oh, well, wait a minute. I don't know why that's relevant, I tell them. That's not relevant. I negotiated a price and a payment plan with you. Does it matter how I'm getting paid? I don't think it should. But boy, they seem to think it did. But that's part of the problem. Is the first thing they ask you is, what insurance do you have? Or now, because of Washington State, they ask you what kind of health sharing ministry you have. And my personal opinion is, it is none of their business how, if you're paying the bill, it is none of their business how you are going to get reimbursed from somebody. So in the future, I'm going to be very careful. I'm not going to lie to them, but I'm going to say, I'm just going to say, yeah, I'm cash pay. And that's all you need to know. I'm not going to tell them I have anything else because it's none of their business. So as long as they get paid, it should be none of their business. So that is a quick overview of my book, The 6-Step Solution. But go ahead and download it because there are 7 chapters. There's 2 other big solutions in healthcare. I'm not going to give those away. You got to read the book to get it. But it's there's 2 other big steps. They're big ones, and they include the government. And remember, the government ruined it. I really honestly believe that. So I don't think the government can fix it. So read the book, download it on Kindle form, Amazon, or buy the paperback. And if anybody has any questions or comments, please let us know. We stream live on the Moses Lake Professional Pharmacy Facebook page and the YouTube site. We are really growing our YouTube. I would really, really appreciate it if you go and like our YouTube channel and subscribe to it so you don't miss any updates. And we also are on all the podcast forums. So if you don't want to have video, we are on Google Play, we are on iTunes and SoundCloud and so on, your favorite podcast forum. So go in there, like, share, and we stream on Mondays, usually 1 to 2 p.m. Actually, 12:30 to 1 now. We've changed that schedule so my beautiful wife can be with me. And we, on our midweek podcast, we call it, we're normally there on Thursdays, 8 to 9 a.m. We had a last-minute schedule change today, so we are streaming early today on Wednesday. So catch those shows. Monday, you don't want to miss it. We are back into our plastic surgery segment. We're on part 3, and we're going to be talking about liposuction. And you might be surprised how much time we can talk about liposuction. It's a big deal. We're also going to talk about the week after tummy tucks, and then we're going to wrap it up all with mommy makeovers in a few more weeks after that. So you don't want to miss it. Our plastic surgery episodes are going very well. So that's it for today's episode. I'd appreciate any comments that you have, and you can like and share this. I really appreciate all of our listeners and viewers. And you've been listening to Health Solutions with Shawn and Janet Needham. Thanks for listening.